One trial I'd like to highlight that's in progress, that's an investigator-initiated protocol that I'm leading along with my colleague, Dr. Odenike, is a phase 1b study of Ivosidenib plus Ruxolitinib in advanced phase IDH1-mutated MPNs. Outcomes in advanced phase MPNs, whether that be the accelerated phase, blast phase, or JAK inhibitor myelofibrosis, JAK inhibitor exposed myelofibrosis, are quite poor. With that in mind, I think there's certainly a need to investigate and identify potential targeted therapy approaches in this setting. IDH1 and IDH2 mutations are enriched in patients with accelerated and blast phase MPNs, and there is retrospective data to support the use of IDH inhibitors in this setting. In addition, there are preclinical data to support combined JAK inhibition and IDH inhibition as a therapeutic strategy in IDH-mutated, JAK-mutated MPNs. So with all of that in mind, we have designed a phase 1b study that looks at the IDH1 inhibitor Ivosidenib combined with the JAK2 inhibitor Ruxolitinib in patients with an IDH1 mutation that have either an accelerated or blast phase MPN or an MPN with greater than or equal to 5% blasts. Patients with chronic phase myelofibrosis can also be included if they've already been treated with a JAK inhibitor and have not responded to the JAK inhibitor. The primary endpoint of the study is to really determine the safety of combining Ivosidenib with Ruxolitinib in the appropriate dose level. But secondary endpoints will be looking at efficacy response, either myelofibrosis-based efficacy criteria for those in the chronic phase, or MPN blast phase-based criteria for those with greater than or equal to 5% blasts, along with survival outcomes, molecular mutations that may influence likelihood of response, and the molecular mutations that are seen at relapse or progression of disease.